Not all superheroes wear capes. Some wear surgical gloves. Dr. Palani Vellu isn't just a surgeon. He's a game changer in laparoscopic and cancer surgery, pushing boundaries with skill, strategy, and vision. Back in 1991, he brought minimally invasive surgery to South India, making surgeries less painful, recovery faster, and getting people, especially farmers and workers, back on their feet in no time. Today, his innovations are gold standards worldwide. Through 390 plus free medical camps, his GEM Foundation has given life-saving surgeries to those in need. Because for him, healthcare isn't a luxury, it's a necessity. He's trained rural surgeons, pioneered cost-effective techniques, and made advanced surgery accessible to all. And on the global stage, 50 plus countries, live surgeries, top awards. He's setting new medical benchmarks every day. A visionary, a mentor, a legend. Please welcome Dr. C.PALANI Vellu.
Good morning. Good morning, all of you. I'm truly excited to be here, stand before all of you. Chief guest, Samiji, friends, President of IMA, IIM President, and Akhilesh, past President, and invited faculties, and eminent management experts, students, and I'm delighted to share my experience today. The title is Struggles to Success. I'm one thing is going to talk. I've not read, I went to management school or read any management books, or we doctors are poor managers generally. We look at as a professional fellows. We don't look at management as a part of our career. And lately, when we all grown bigger level, then we realize, oh, we missed the management part of the professional. This is supposed to be very essential. That we look at this. It is completely which I am going to share to you. It is my personal journey. And journey in the sense, it is also successful, how it happened, and it is a byproduct of our own profession in management part. And today I will share like this. And generally, everyone is planned in life. And in my life, nothing can plan because of need. Whatever decision, circumstances comes, take it up. But today, kids, all well planned, orchestrated by the parents or by the government or media, somewhere it is full-fledged. And I'm going to share how it is went on. I will briefly say, early 50s, after independence, South India, if you go through history in the books or everywhere, severe drought. If you go to the Western Asian side, Sri Lanka, Malaysia, Burma, most of South Indians were there. Reason, when drought, no culture, agriculture, that is a primary earnings for every family. So my parents moved to Malaysia when I was 3 years kid. They were working as laborers in palm oil estate. And I studied in Tamil medium because there were palm oil estates, rubber estates, most of the states, nearly 90% are Indians, there were the Tamilians. So Tamil medium school was there. I studied up 5th standard. And after that, we have to go to English medium. English medium, we have to go 1 year remove class, bridging course like. So after finishing 5th, I went to remove class 1 year. That is the time 1962 war, Indo-China war happened. And after this, frequent quarrel between Indian and Chinese in Malaysia. Indian means Tamilians, I told you, no. As a student looking at them, oh, these are enemies for Indians, no, Chinese. And also, this is a foreign land. Why should we study there? Why not go to our great India? That's what 1963, when IMA formed, I took a decision, took a TC from the school, and came back, showed the TC to my father. What would happen to me, no? He became furious, gave me one slap immediately, no? Because he was not against me going to India. I want to go to India to study. He was not against, but no money to buy a ship ticket to send me to India. That's why he was furious. Then I was put into toddy shop. 4 months I worked as accountant to enter in the toddy shop. Monthly 10 ringgits, that means 15 rupees. 4 months, then I realized, oh, lifetime work, we cannot go to India. Then what I did, I joined as a coolie, daily wage laborer in the palm oil estate myself, at the age of 13. Then 4 years, 3.5 years, I worked as a daily laborer, 30 to 40 rupees I won monthly. After 3.5 years, you could buy a ship ticket. That time my father told me, take your mother also and your youngest sister go to India. I came to India. We had a few acres land. That time it was very dry. Now by the time we came, we had a good water, wells, and we were started cultivating. My mother was working. I was looking for admission to schools, going round, but no school willing to give me admission. Obviously, no. I told you, remove class certificate with me. I studied only 5th standard. My age was 17 at that time when I returned to India. So what I did, frustration, I don't know, I came to India for study, but no. That time one school, an higher elementary school teacher admitted me in 8th standard in a different boy, because I did not have a certificate. The different boy, see, the same name Palani Vellu, no, one fellow discontinued from the school. 8th. But name same, but his father happened to be Periyasamy. Periya means, you know, Tamil, it is a big, Sami god. No? My father, Chinna Sami, small, no? That is why it is. But I studied 8th, I went to different school, 9th, to 10th, I was continuing it. God always, when you do something, mistake, no? Saying somebody's father, nobody will accept, no? I did not know legally that time. I want education, that's all my prime aim. So, before quarterly, I got a debar order from the CEO office. Father at that time returned from India, Malaysia to India. But my headmaster, union local chairman, and my father frequently to visit CEO office at Coimbatore. CEO was adamant, as per rule, he wanted to act. And did not give me 1 year, almost completed. And headmaster asked me to come to school, continue to study. I said, no, I know how to work. I cannot come bogus. Let me work in the field. I was working one field, this again gap. And that union chairman, you must all remember how the guys, that politician was there, no? He was union chairman. Last visit, he bent down, touched the CEO office. The foot, when he touched it, he's only a 40 plus. This guy is 70. And it's like a fatherly figure when touched the foot of the CEO. CEO was so much agitated. And in 2 days' time, I got the readmission, the school back. Then, continued, during the time, I took a decision that I should become a doctor. See, my age, my school education, my mind is going. Reason were there. The younger sister I brought to India had a pneumonia, died without any treatment. No doctors available there. My own left finger, also deformed finger, anybody can appreciate. I was working in the field putting stones in the bullock cart. One of the stones returned back crushed over the wheel. And my maternal grandfather put a native leaf, left me 5 days not removed, no? Agony, pain, sleepless nights, 5 days. Then we traveled more than 20 kilometers to seek a MBBS doctor. He removed and put one injection. Pain disappeared in a few minutes. Well, I'm coming out to the clinic, I decided I'm going to become a doctor to work for the rural areas. That is a decision I took. Okay, fortunately, I took PUC St. Joseph College, got MBBS admission in Stanley Medical College. Whole village is celebrating me, coming and appreciating, one of our first doctor from that area, no? But my parents were all sitting agony with restless. See, other way. Why? You have to pay fees, no? We are poverty in line, no money. What to do? Mother, father, and both were so much that is around the village people all. My father could borrow money from them. I paid fees for MBBS admission. Subsequent MBBS also, they supported me by loan. It is a generous, villager support. They are not very rich, but they are all supported me. I could finish MBBS, then went for MS. During MBBS, and my professor of surgery, and I was not very studious because passing MBBS is very easy, I just going to. But he told me, Palani, you looks very good for surgery. Somehow you go to MS, you will become very good surgeon in future. I don't know how he predicted me. He fond of me so much during my MBBS. Then I wanted to go to MS. And the village people, some of them decided, oh, this man, the money is not going to come back. Some of them started pressurizing to get back the money. Naturally, they are poor people only, Then I have to do MS. No money with my parents. Also, village people no more willing to support. What would have been the idea? I'm a graduate, that time MBBS, not finishing house surgery only. My father gave me a good idea. What will be, some of you can think over? He asked me, you get married, Doctors were married, they will become something differently, I'm not for dowry sake of marriage, but I want to do MS. For that girl, Jaya, came from a rich family. He supported my money. I paid some of these demanding loan, people, fine. And I need some money for my marriage expenditure. That also, in-laws gave me for expenditure. I could conduct marriage. But once married in a affluent family, the remaining people did not ask me money. Thought one day it will come, very nicely left it me. Then I could finish MS. Then after MS, I did DNB also. Then finally went to All India Institute for Postgraduate Fellowship. Returned back to Salem Headquarters Hospital as a consultant because my aim was to serve the rural areas, returned back. So my father-in-law gave me 2 acres land in the heart of Salem town. He himself contracted, wanted a big hospital, and plan was everything ready. But destiny, we do not know God's destiny. MCH in surgical gastrology was introduced first time at Chennai. Professor Rangamasham, the head of the department, asked me to come and join. See, one side the hospital is going to come, the other side, he may not, but he is asking me to come. But which should take it? Yeah, anybody can do hospital, but specialization is my one. So I went back to Chennai. When in-laws were not happy, but still they have to accept no other way, While I am doing MCH, the reason also for MCH important. When I was doing MS at Madurai Medical College, I saw cancer, some complex cancer like food pipe, esophagus, liver, pancreas. They will all go without treatment. Even some, if I get surgery, many of them dies. Even if by escapes without complication, within few months they will come back with recurrence. It is something irritated me. Why not become a specialist to take care of this unfortunate group of people? That's why I went for MCH rather than taking an hospital. Okay, after MCH, what will I do? After MCH, again, father-in-law wanted to build the hospital, but I did not go. Why? I want to promote the science. So I need a medical college, teaching institution. So instead of Salem, I went to Coimbatore. Coimbatore was from my native place. I went to Coimbatore, joined Coimbatore Medical College Hospital. I was very happy operating all major surgeries, because I was the only specialist in South India other than Chennai. And so concert, everybody, I'm happy. But suddenly one day, again problem came. One of my relatives came to me for gastric cancer operation. I did it. 2 weeks he was with me. His wife did not come and see him. Don't take it the other way, They are very good relation only. Then I went a couple of months back. I asked her, Annie, such a major surgery I've done. Why you didn't come and see him, She said, Palani, how can I come? Watering the field, feeding the cows and sheep, sending the children to school. Who will do it? I was the only guy, and I cannot travel alone. Somebody has to bring me, It is 120 kilometers away, not possible, See, I'm a farmer. That lady gave me a good lesson. You cannot be happy whatever surgery you do, after that. I was working how to help the farmers to get back to farming faster. That is the time I saw a video, laparoscopic gallstone removal in a congress. When I saw that day, there were 1,000 surgeons all talking against laparoscopy. Oh, this is a cup of tea, will cannot be there, it will go. That is the day. But for me, That light looks like a something, oh, I had a something, it has come to me. If I develop, I can help the farmers. What I want to do it, no? Then I came back. I introduced laparoscopic surgery, first time in South India at Coimbatore, even before Delhi, Bangalore, Calcutta, Chennai. Only one surgeon, Bangalore, Guwahati, was just did a gallbladder. We were together, started initially. But he is aged man, he could not move beyond gallbladder. But I'm MCH, background experience, young, so I have to do much more can do, no? So want to extend this procedure to other diseases. I went to America for 1 month training. I paid $3,000 for animal training for 3 days and also traveling other hospitals. It involves a lot of money. So I borrowed loan from my friends, went for advanced training, soon came back. After coming back, conducting regular training courses, inviting surgeons, teaching them, so happy, very nicely. Within India, nook and corner, people will come. Initially 100, 300 first workshop, second 700, subsequently third workshop onwards 1,500, 2,000, even 10,000 of them. We did not find a hotel or a hall to do it. I used to conduct in marriage halls workshops, that day it's so popular. And not only that, the demand started coming. They used to call Coimbatore as a temple of laparoscopy or Mecca of laparoscopy line. Then after that, demand came to inviting me to come to India across, also neighboring countries. Every week I have to travel. So being in a government service, not possible, no? They will not take it lightly, no? Restrict leave facilities. So I thought, okay, I have to quit government service. I left the government service, wanted to start at a government hospital, in a private hospital. That is a GEM hospital I established first at Coimbatore. GEM means Gastroenterology Medical Center and Hospital, GEM. When I started single center super special hospital whole country, this is GEM hospital in Coimbatore. But all the senior surgeons, everybody threatening me, don't take chance. Because money was not with me, no? Bold I do it up. No, why not you have multi-specialty that you can run easily? Multi-specialty, even non-doctors can start. What else I studied MCH and all, no? I decided single super subject. So soon this hospital became so popular, not only big business guy of Coimbatore or Tamil Nadu, from Delhi, Bombay, Kolkata, everywhere people started coming, and GEM hospital made me. So finance was not a problem. I became very comfortably start running it. So that is a way it started again. Again, not only that, laparoscopic, then robotic, then endoscopy. All together, it makes something, a new technique so much. You will be surprised. In America, every year I have to go and present my video. 25 times my video considered awarded, and 7 years I was the #1 ranking in American media as presentations. Not only that, one of the time they had an Olympic surgery competition wanted to promote. An American Japanese society held it at Phoenix, Texas. That year I was for Whipple, pancreatic cancer, and a French surgeon for liver, American for rectum, like Japanese for stomach, like different 9 surgeons selected, final round. And me and French surgeon came almost together, openly then on stage, in order to avoid tie. And he was senior and was junior. He made gold, I was made a silver medal in America. Our Indian flag hosted in America. I was so happy that we could compete and come back. So this is one extent. And next is another important thing came. And when you technique improving and technology making up, gastroenterology is not, those days gastroenterology is just like a super specialty. Now it became no more super specialty. Each organ is super like. Esophagus, stomach, pancreas, liver, rectum, and everything different organ specialty. So I developed more thing. My institute, GEM Hospital, became a multi-organ super special hospital. That is the first hospital made it. Even Tata Cancer Hospital, TMH Bombay, after looking at, okay, focus surgeon is better, they started splitting into different specialties, and so that way it went on. That not only that, same laparoscope, robotic, this, also useful gynecology, urology, pediatric surgery, etc. So I started, when I'm moving on, even All India Institute, urologists used to come to Coimbatore, and everywhere they wanted to do. Urologists came and pediatric surgeon came, everybody. I started training them. GEM evolved from gastroenterology minimally invasive institute of India first time. That's why when established second hospital, Chennai, a GEM hospital, it not only gastro, it is minimally invasive institutes including urology, gynecology, pediatric surgery, everything. But only abdomen. Again, no general surgery, nothing, because I want to develop a one concept. That is why it went on very nicely. Then, and I wanted to make it this surgery across. Whenever I go to present in America, everywhere, it is always attractive. No, I told you so much. I was called to Lima, Peru, Argentina, like everywhere. And when some of these few surgeries, India today considers like if you take a software or other things, India is in the top. No, similarly, I'm very proud to say that some of these surgeries, India is considered the top in the world. For example, if you take it hernia, cancer, bariatric surgery, and this we are on the top. Why? I will briefly say for the youngsters, I didn't, for not revenue sake I was doing it, but it directly paid differently. For example, if I take hernia, how many of you know, small water, get water. How many of you know, among all the male population, 25 to 27% will have a hernia lifetime. India is 60-70 male population, crores. After 20%, how much? 15-20 crores people will have hernia. And if you operate by open method, 10% recur. If a recur means he has to go and undergo so much, open that. What I made, I at that time went to America in 92 for advanced training, thinking that the people will do much more than learn. So I spent more money. It is a very costly tour, but again, confidence returned back. When I did first hernia in Asia first time, and everybody surprised, everybody said it's not going to happen. And today, no beggars also will ask for open hernia if he knows the value of laparoscopic robotic hernia repair. For example, today I have my own technique. It is called Palani Vellu's hernia repair for groin hernia. When you can do it, patient goes in with less than 24 hours. Next day, you can start working it, and no recurrence. How much it is made economy for individual, for the country. For my own hernia, I got operated in the evening. Next day morning, 7 o'clock, I was operating in the OT. See how faster recovery? My own trained young surgeons operating, Palani Vellu is taking on me itself. God has given me opportunity, I have to test myself. Somebody against junior sir, no. Somebody say, my son knows about me, my wife knows. No, he will always try and let him go. He asked me morning, 7 o'clock, I went in. So, this one. Okay. Second, if you ladies undergo open operation laparotomy, what will be the problem? 30 to 40% ladies develop incisional hernia. If you incisional hernia, if I operate open, again 50% more recurrence. So, for which laparoscopy, Americans defined taking, putting a mesh inside, mechanical tackling, highly cost in India sorts. Not only that technique is not to India. That's called IPOM, placing a mesh inside, take it. What I did a few cases in India, in ladies were not happy. Why? Indian ladies' abdomen are flabby, loose, particularly after delivery, So, what I did my own technique, suturing inside, bring the rectus muscle midline, put a mesh. Abdominal grip increases. After repair, these ladies started working few days. Recurrence, again we reached 0.6% that time. I presented 720 cases in American Hernia Society. Their recurrence 4%, our recurrence 0.6 that time, now 0. And they were appreciating so much. And now that become the guidelines standard technique. Then they named my technique how? Their IPOM, my IPOM plus, extra, more strength, That way, this incisional hernia today, ladies we can operate. Then I realized, why the ladies developing in a hernia, if you make incision in a hernia, avoid incision. That means do laparoscopic robotic, no hernia will be there. Then I started teaching the gynecology also with other, of course, Bombay and Cochin gynecology, they're very leading before me. And also joining with them, teaching the all gynecologists, avoiding a laparotomy, do a laparoscopy, except cesarean. Cesarean we can't do, rest of things we can do by this way. So that is where today, when I wrote a hernia book, it is translated in all the languages, Korean, Chinese, Spanish, and it became because the innovation is from us, so that book carried across the globe. And when I showed her this video on Rome 98, immediately there itself invitation to come to Argentina to perform a live surgery. I'm an English guy, those people Spanish and this. I have to keep a translator, then operating, showing them. So that type of thing. Second more important thing is I want to tell you, cancer. And you all know cancer is going up so much. We're talking, and if you say now after COVID, even a youngsters developing more number of cancers, very important. Reason being immune down. And we will be surprised if you tell any common people, I don't know, you are also, most of the crowd also will say, cancer means 50% they will mentally die, They say it is incurable, it is no more normally possible, they can't eat normal diet, and we have to undergo chemo, radiation, which they consider the standard therapy. Finally, imminent, any time they may die. This is what public opinion. I also, same opinion before 30, 40 years. Now, no more. Why I am telling no? Today, any cancer in the abdomen, gastrointestinal system, uterus, ovary, prostate, bladder, kidney, or lung, surgery is the primary treatment. And if it comes advanced stage, no other way, radiotherapy, chemotherapy, palliation. If you can operate in early stage, curable. So cure can be achieved. Timing? Okay. So that's way to do it. Cancer today, we made a laparoscopic magnification more, and clearance can be done. Today we have a technology staining the cancer cell like insects in the night glowing. Identification easy, you can remove. And if you keep an apple, 3 days a cut pulp is normal. If you even a fresh cut, you keep it within 2 hours, you can see the color changes. So immune goes down by opening, avoiding opening. That's why Japanese government encouraging giving a insurance premium more. So that way one. Obesity, diet related, lifestyle, and we are more problem, developing type 2 diabetes 90%. It is our problem, it is not a pancreatic problem, our eating problem. And so, and today type 2 is controlled by your exercise, otherwise can curable by surgery. We won the award in America for type 2 diabetes by surgery curable. Last message only, because want of time, I will adjust few slides for management sake, I'll say. Looking back at every step, I think the need of the society and my personal drive made me to do what they think those days. At that circumstances, it may not be the best decisions at that time, but today it makes me more. Second, you all start up where we talk about the problem solving and impact business. What better than helping the people live healthy? Second, creating community of surgeons who are now and making people live longer and also business out of it. And I can I certainly say I managed to create the most impactful business, hence a very, very happy person today because the way it has reached the community. And you know the book called Good to Great by Jim Collins, Hego concept, Fox and this. So it is very important is to live a simple life but stubborn life. So that again more important here. The book was released in 2001. I established GEM Hospital by the time 2001. And today I can certainly say we have created a great community. And last say, don't be hurt looking at your revenue or EBITDA or profits. Everyone enjoy your moment, every moment of life happily. Do it the best. And with all, everyone can succeed in making great companies. I wish all of you a very important thing. And last word, one way I'm going to give to the guest. Abdul Kalam asked me to write a book, autobiography of mine. It has been published recently in the name of Guts. And Tata Group Chairman Chandrasekar reads the book and was fascinated to look at this. Kalam told me, Abdul Kalam asked me, your life is interesting. It will inspire the youngsters. Write it. I could say or recently only. Anybody, it is available on Amazon. Please kindly go through. Whatever you believe is said, and whole book will be useful, I hope, for the management group. Thank you very much, patient listening.